This is Dr. Russell. I'm the ear, nose, and throat and facial plastic surgeon here at National Allergy and ENT. And I want to talk a little bit today about one of the most common conditions that I see and treat here, and that is sinusitis. So we all have 4 sets of sinuses in our head. So we have the frontal sinuses up here, the maxillary sinuses in the cheek, ethmoids in the center, and then the sphenoid sinuses even a little bit further back. And so sinusitis is inflammation of these sinus cavities, an infection with either a virus or a bacteria. And you basically have several symptoms that can go along that put together would indicate that you have sinusitis. So that includes pain or pressure in the region of the sinuses, purulent nasal drainage, so that's discolored drainage, that's yellow, green, or milky color drainage from the nose, nasal obstruction, which is difficulty breathing through the nose, a decreased sense of smell, and fever. Some other minor symptoms that can also go along with sinusitis include ear pain and pressure, headache, and pain of the upper teeth. And so when we're figuring out the best way to treat patients for these problems, sort of knowing the timeline is helpful. So acute sinusitis includes any of those having those symptoms for up to 4 weeks. Subacute sinusitis is 4 to 8 weeks of those symptoms, and then anyone with those symptoms for 12 weeks or longer is defined to have chronic sinusitis. So acute, subacute, and chronic. And then there's a special subtype, which is recurrent acute sinusitis. So these are patients that have those acute less than 4-week episodes, but have 4 or more of them in a year. And so typically if you have sinusitis symptoms lasting for more than a week, that's typically when you can see your primary care provider, and depending on your individual circumstances and exam, you may need an antibiotic and or steroid. If those symptoms start going into the subacute and then the chronic phase, lasting more than 12 weeks though, that's when our role sort of comes into play more in the ENT side. And so I tend, for those patients that have those longer lasting or recurring symptoms, I'll take a look deeper inside the nose around the opening of the cavities with a nasal endoscope. And then based on those findings, frequently we'll get a CT scan of the sinuses as well. And then that way we can identify if these recurring or prolonged sinus symptoms are a cause of an anatomic problem, or a growth in the nasal cavity, or perhaps even nasal polyps, which is something we'll talk about in a future video as well. So hope this helps, and you all have a great day.